Stop guessing symptoms. Get ahead of whooping cough in children. Pertussis, commonly known as whooping cough, is highly contagious. Look out for early symptoms like mild cough, runny nose, and low fever. These can escalate to severe coughing fits, sometimes ending with a whooping sound. Infants may show signs like apnea and cyanosis. For treatment, antibiotics such as azithromycin or erythromycin are effective in the early stages. Ensure vaccination with DTaP for kids and Tdap for older children and adults. Isolate the patient to prevent spreading and monitor for complications like pneumonia. Remember, early detection and prompt treatment are key to managing whooping cough effectively. Stay vigilant and keep our kids safe.